Thank you, everyone, for allowing me to speak about implications of emerging cardiac medications. So today, my agenda, I'm going to speak about GLP-1 receptor agonists, SGLT2 inhibitors, small interfering RNAs, and cardiac myosin inhibitors. I have no financial disclosures. So before I speak about diabetes, I want to speak about some statistics, diabetes and cardiovascular health. So there's some pretty shocking statistics that greater than 133 million Americans have diabetes or prediabetes. Now, 1 in 4 patients over the 65 have diabetes, and 90 to 95% of those patients have type 2 diabetes. 32% of patients with type 2 diabetes have heart disease. 68% of the patients with diabetes over 65 will die from some form of heart disease. And this is another startling statistic. Among patients with type 2 diabetes, the prevalence of heart failure is 4 times higher than the greater population. So we're going to start with GLP-1 receptor agonist. I'm sure everyone looks at these. I'm sure people are pretty familiar with Wegovy, Mounjaro, Trulicity, Ozempic. Some people here actually might be on those medications. If not, I'm sure you've seen it on one of these ads, whether it be in the subway, media, or social media. I'm sure everyone's seen these medications. Let's talk about it a little bit. So what is a GLP-1 receptor agonist? So it stands for glucagon-like peptide 1 receptor agonist. As you can see in the cartoon over here, this is how GLP-1 acts on all the different organs of the body. So how does it work? What's the mechanism of action? So it slows gastric emptying by the release of glucagon. It suppresses gluconeogenesis while stimulating insulin production in the pancreas, thereby reducing hyperglycemia with patients with type 2 diabetes. Now, who is it indicated for? So originally it was indicated for patients with type 2 diabetes. Now it's indicated for obesity, weight loss, and cardiovascular risk reduction. Just of note, these type medications and SGLT2 inhibitors, they're the first-line pharmacological therapy for patients with type 2 diabetes who have or are at high risk for atherosclerotic cardiovascular disease. What's the dose? So the dose is definitely dependent on the different medications we use. Most of the administration is subcutaneous. However, Rybelsus is an oral pill. Let's talk about some outcomes, some clinical trials. I'm just going to concentrate on 2 right here, the SUSTAIN and the SELECT trial. So the SUSTAIN 6 trial showed significant reduction in deaths from cardiovascular events with the use of subcutaneous semaglutide, Ozempic or Wegovy. It also noted the highest reduction of hemoglobin A1c. Additionally, with the SUSTAIN 6 trial, it noted a 14% reduction of primary outcome of the 3 component of major adverse cardiovascular events. Now let's talk about the SELECT trial. This trial included 17,000 patients with obesity and heart disease. They were studied over 5 years. So what was noted is that the patients receiving these GLP-1 receptor analogs had a 20% reduction in cardiovascular events compared to those who were given placebo, which is pretty amazing. Now, what's some of the side effects? I'm sure everyone's curious. If not, they've had or someone they know have had some side effects from these type medications. So most commonly, patients can experience some nausea, vomiting, or diarrhea. Now, just of note, 5 to 15% of these patients who actually discontinue it, that's the reason why. Hypoglycemia. So that typically only happens after patients are on other diabetic medications. Patients can develop pancreatitis, cholelithiasis, which is stones in the gallbladder. They can also develop, so with Wegovy, it's been noted, with patients with diabetic retinopathy, you can be a temporarily worsening. And they can develop some cardiac conduction abnormalities. Okay, now on to our next class drug, SGLT2 inhibitors. I'm sure, same thing I was speaking before, I'm sure someone you know or yourself might be on one of these medications, Jardiance, Invokana, Farxiga. If not, you've probably seen a commercial. So what are they? So it's a sodium glucose co-transporter 2 inhibitor. So let's speak about it. As you can see the cartoon. So what do? They induce glucosuria by inhibiting the sodium glucose co-transporter 2 pump, which is located in the proximal nephron, and reduces tubular glucose reabsorption, which basically reduces blood glucose without stimulating insulin release. What are these medications indicated for? So they're considered first-line pharmacological therapies for diabetes, heart failure, and chronic kidney disease. The dose depends on the medication. It's administered orally. Some interesting facts for these type medications. So they reduce of MACE, which is major adverse cardiovascular events, across a broad range of patients, irrespective of atherosclerotic cardiovascular disease, diabetes, and kidney function. Additionally, they reduce the risk of cardiovascular death and hospitalizations for heart failure patients, irrespective of ejection fraction or care setting. So what's some of the side effects? So these medications typically make patients urinate quite frequently. They could develop dehydration, kidney issues, diabetic ketoacidosis. This is one of the most common, is actually females can develop yeast infections, urinary tract infections. And of note, this amputation risk, this is basically for all the diabetic medications, this is the highest risk medication. Unfortunately, the mechanism is not quite clear at this point. Next class, let's speak a little about small interfering RNAs. We're going to specifically speak about inclisiran, or Leqvio. So what is a small interfering RNA? So it's a type of RNA that has a potential to silence a specific gene expressions which prevent their subsequent products from being formed, which increase hepatocyte recycling and membrane expressions of LDL receptors and decrease levels of LDL-C. What does that mean? Basically, it interrupts the production of PCSK9 protein and allows the body to clear more LDL cholesterol, as you can see here on the cartoon. So lowering of LDL-C significantly lowers the risk of cardiovascular events. Just of note, statins still are our first-line medication. They're still our first line of defense. However, these PCSK9 inhibitors, they have become a strong tool to assist, in some cases, replace statins. So how do they work? Just as I was explaining, so these type therapies have the potential to silence a specific gene expression and interrupt this PCSK9 production, allowing the liver to clear more LDL-C, as we can see here on the right. So what are they indicated for? So they're indicated for as an adjunct to patients on maximal statin therapy, with patients with familial hypercholesterolemia and or atherosclerotic cardiovascular disease. The dose is 284 milligrams. It's administered subcutaneous every 36 months. Now, of note, these lipid-lowering therapies, such as inclisiran, in combination with statins, will enable more patients to achieve their goal LDL-Cs and to address the high global burden of atherosclerotic cardiovascular disease, as Dr. Kinney and Dr. Sharma were explaining before. What's some of the side effects? So patients can experience redness around the site, diarrhea, some shortness of breath, dysuria, and arthralgias. Okay, we're going to speak about our last medication here. Medication class is called the cardiac myosin inhibitor. What do we treat it for? It's treatment for hypertrophic cardiomyopathy. Now we're going to ask, many of you will say, what is hypertrophic cardiomyopathy? So it's actually when the heart muscle becomes abnormally thick and stiff, making it harder for the heart to pump blood. This is typically caused by a change in a gene that causes too many connections or cross bridges between actin and myosin proteins, which basically makes it harder for the muscle to relax. As you can see, the normal heart, and you can see the widening on the right with an obstruction. That's the obstructive hypertrophic cardiomyopathy. Now, what's some of the symptoms these patients can experience? So some patients actually experience no symptoms whatsoever. However, some of them can experience some shortness of breath, palpitations, lightheadedness, fainting, or fatigue. So what's the mainstay treatment for these type patients? So we can do surgical therapies, which is septomyectomy. Anyone here works in the cath lab, we could do alcohol septal ablations, which actually shrinks the heart muscle. Or medical therapy, beta blockers, calcium channel blockers, or this medication we're talking about now, which is a cardiac myosin inhibitors. Now, some of these patients, we do implant defibrillators to prevent sudden cardiac death. Now, let's talk specifically about this medication. How does it work? So this medication actually targets the underlying mechanism of hypertrophic cardiomyopathy by inhibiting and reducing the number of actin and myosin cross bridges. So it improves how the heart relaxes and fills with blood, reduces how hard it has to work, and it reduces how much energy is used. As you guys can see on the right, you can see actually the less cross bridges on the right where it says hypertrophic cardiomyopathy sarcomere with mavacamten. Now, what is this medication indicated for? So this medication is specifically indicated for adults with symptomatic New York Heart Association class 2 to 3 obstructive hypertrophic cardiomyopathy to improve their overall functional capacity and symptoms. Just of note, these patients, this medication should not be used with beta blockers or calcium channel blockers because they can be noted to reduce the overall ejection fraction. What's the dose? It's 5 to 15 milligrams. It's administered orally. And side effects. So the number one side effect is the concern of this medication. It can actually significantly reduce and put someone into heart failure, and specifically systolic heart failure, these patients will be followed by serial echocardiograms to make sure their ejection fraction does not diminish. They can also experience some dizziness, shortness of breath, and fainting. Okay, now let's talk about the key takeaways from this talk, guys. So GLP-1 receptor agonists. We all know it's a groundbreaking type 2 diabetes, obesity, and weight loss medication. And it can significantly reduce your cardiovascular risk factors. SGLT2s, they're indicated for type 2 diabetes and heart failure. And they reduce the risk of major adverse cardiovascular events across a broad range of patients, irrespective of atherosclerotic cardiovascular disease. Small interfering RNA, what do we need to know? They're indicated for elevated LDL-C with patients with cardiovascular risk factors. In combination with statins, these medications can significantly reduce your LDL-C. And last but not least, cardiac myosin inhibitors. This is non-invasive treatment for patients with New York Heart Association class 2 to 3 symptoms of hypertrophic cardiomyopathy. Thank you.